Happy Wednesday, y'all. I'm Shmika Rhymes, your host for this evening, and you know this is Soulibration. Let me know where you guys are watching from in the chat, and let me know what you think about this new background. Do you see it like around me? Do you see it? Let me know what you think, or if you have any other ideas of what it should look like, because we're just trying to come up with something new that's going to catch your eye, because, this is the 20th anniversary of blackdoctor.org this year. So anyway, remember to share this with your network. And if you have any questions during the show, drop it in the chat. And have you ever experienced hair loss? And maybe you couldn't figure out what was causing it, or maybe you got a diagnosis that you really didn't agree with, or you couldn't get some clear answers on why it was happening or how to treat it. Well, y'all know I got you, right? So tonight we're going to be talking about hair loss or alopecia. It's a universal issue, but for Black women, it comes with a unique challenge. Misdiagnosis, delayed treatment can mean the difference between regrowing your hair and facing permanent balding. So tonight we're going to uncover the key causes of hair loss in Black women, why it's essential to find a doctor that has that experience with treating hair loss in patients of our ethnic background, and whether it's related to genetics, hairstyling practices, or health conditions. We're going to take a deep dive into what you need to know so you can advocate for your hair health. So I am super excited about tonight's guest. Her name is Dr. Dina Strachan. She's an award-winning board-certified dermatologist. She's a graduate of Harvard and Yale, and her expertise goes beyond just skincare. She's a media personality, speaker, author, and consultant, and you've probably seen her on Netflix. And she's currently on faculty at NYU. So let's bring on Dr. Dina.
Hi, Shamika.
Hi, how are you?
I'm great. Thanks for having me tonight.
Well, I got to ask you, what do you think of the background?
I think it looks great. I think it's on point.
Thank you. So we're going to start this off with, because so many people don't seem to really know the difference. So like if there's different types of hair loss. So what are the most common types of hair loss that affect Black women?
Well, there are many types of hair loss, and for Black women, probably the most common type, the one that I see in my practice, is CCCA, which is central centrifugal cicatricial alopecia. And that's, something that's caused by traction. It's a type of scarring hair loss. And it's complicated because there's a genetic predisposition and then there's a traumatic event. But Black women also experience things like alopecia areata. That's the autoimmune one that people often use the word alopecia when they are specifically talking about that. And then there's female pattern hair loss, which is also very common. And that may not bring people in as much to see a doctor, but it's actually very common. And then perimenopausal. And there are a variety of others, but those are the ones I see a lot.
Okay. Goodness, that was like a mouthful, that first one you named. I'm like, I can't even go back to repeat that one.
Yeah. Well, it used to be called hot comb alopecia back in the 50s, 60s, because, it's someone who's using a hot comb. Well, that was a Black woman.
Yeah, right.
So, and that might be the trauma. And then there was a follicular degeneration syndrome. So, our understanding of it has really evolved.
Okay. So you mentioned what alopecia is, but does it always include hair loss of other parts? Because I've seen some people that have lost their eyebrows and eyelashes as well.
Absolutely. Now, you can get alopecia on one part of the body or several parts of the body. So something like CCCA generally affects just the scalp. The scalp is the most common, but alopecia areata, when it can start to affect other parts of the body. So we might call it alopecia universalis, when it starts affecting everywhere and you lose all your hair. You can develop like lichen planopilaris, which is another autoimmune type of hair loss. That's scarring, and sometimes that can affect other parts of the body. So typically the scalp, but yes, other areas can be involved.
Okay. And you mentioned, now I'm having flashbacks about that hot comb. I was just curious, could relaxers cause hair loss?
That's a good question. And I'd say more if it's the hair loss that we'd associate with relaxers is usually a breakage, like trichorexis nodosa, which is what used to be the most common type of hair loss we'd see in Black women until certain hairstyles that were more traumatic, like tight braids, tight weaves, things that put tension and pressure on the hair follicle, became more popular. When I started my career, it was that breakage. People would say their hair isn't growing.
Hmm. Yeah, and I'm asking this as I just got a relaxer yesterday, so I'm like, wait a minute.
Well, it doesn't, I mean,
Yeah,
relaxers typically don't, but
yeah.
anything that changes the texture or
Mhm.
the color of your hair can damage the hair shaft and increase your risk of getting hair breakage.
Okay, okay. So you mentioned tight braids and things like that, and other chemicals. So how do other hairstyling practices? Let's talk about like weaves or some other hairstyles that may contribute to hair loss.
Well, again, anything that puts a lot of tension on the hair and the hair follicle can cause trauma.
Hmm.
So, that's what weaves would do. So, the tension, the glue, uh, how it's sewn in, and just the weight of the hair. You have a few little hairs holding this big hair piece. That's weight. And people think, natural styles are safe, but something like dreadlocks, which is a natural hairstyle. Again, if you've had dreadlocks for 20 years, they grow down to your waist, your hairs are always shedding. So that lock is holding decades of hair. And then those poor little hairs that are actually still attached to your head are carrying all that weight that causes tension. So you have to be mindful of that. You might need to clip them back or wear them up so that you're not pulling on your hair. That can cause traction alopecia, that can cause CCCA.
Okay. Well, and I see some people joining us in the chat. Shout out to Raleigh, North Carolina, and Charlotte, North
Mhm.
Carolina, and Gastonia and Asheville. You guys, make sure you let us know if you have any questions and let us know what you think about this new background. So, with that, is there a specific amount of time that people should, if they decide, okay, I need braids, I'm going on vacation, or I just need braids to give my hair a break? How long do you think they should keep them in to avoid, you know, the possibility of hair breakage or losing some of their hair?
I mean, I think it depends on how long the braids are, the style, but I'd say like 3 weeks.
Okay.
You have to go also by your symptoms. Are you feeling a lot of pulling, a lot of tension? And eventually you want to take them out. You don't want to leave that in for 6 months. I mean, it's going to
Mhm.
grow out, but it's also it's a lot of tension on your hair, and you want to
Okay.
sort of rotate and give your hair a break from holding all that weight.
Okay. So can underlying health conditions, and you mentioned perimenopause, but like, other hormonal imbalances, stress, can it cause or worsen alopecia or hair loss?
Yeah, so one of the types of hair loss that we often screen people for is telogen effluvium, and telogen effluvium is hair shedding.
Mhm.
When your hair is really falling out, and there are so many things that can cause that. So that can happen after you give birth. Often people, they grow a lot of hair during their pregnancy. Their mane gets really thick, and then they lose it. It falls out. Happened to me, and that's to be expected. After childbirth, and then if you had an epidural or a C-section, those can cause it. Surgery, um, the COVID hair shedding that people talked
Mhm.
about. Um, Anything that causes a really high fever. When people talk about thyroid disease can cause telogen effluvium. Even things like syphilis. Syphilis can cause patchy hair loss. It can also cause hair shedding. Nutritional deficiencies. So if you have low zinc, if you have inadequate biotin, you have an inadequate protein in your diet, low vitamin D, anemia, things like that. Lupus causes all different types of hair loss. There is a scarring type of hair loss called discoid lupus. There is lupus hair, where just sort of the underlying inflammation, it almost looks like female pattern hair loss, but
Mhm.
it's not. Lupus can cause just hair shedding. So there are a number of things. So that's the one we worry about more, with the underlying medical problems. And then, of
Okay.
course, perimenopause is like female pattern hair loss that happens around the age of 49.
Okay. Whew, we
It's
just
a
can't get a
lot.
break.
Well, half of people, in their lifetimes are going to experience sometimes of hair loss. So
Mhm.
it's very common. So
Yeah.
it's important to understand the different types.
Mhm. Yeah, because I actually I mentioned it in my Instagram stories about my own hair loss came from low ferritin, low iron, fibroids, stress, um, all the things. But, and it just really took the dermatologist plus, my hairstylist to really work together to, get it to grow back. It grew back. Spoiler alert, it grew back. But can you talk a little bit about the mental health aspect of it? Of losing your hair, because that's a big deal.
Well, yeah, we are social animals. So hair is part of our social experience. Hair is a reflection of our health, our fertility, our wealth, our beauty. And so it has meanings other than its function. I mean, it's not just for vanity. Hair has, it helps you control your temperature, it protects your skin, and then in the social side, it tells you something about your age. It
Mhm.
tells you about something about your health and diet, your fertility, um, you know, your fitness as a certain type of mating partner, just all these different things. So when something starts to happen to people's hair, aside from the concern about underlying health, there's a
Mhm.
concern about their social status. You know what I mean? How they fit in our social animal hierarchy.
Yeah. I see we've got the same, almost a similar question going on in the chat right now, so I might as well address it now. I see quite a few are asking what to do about thinning hair.
Well, that's a great question. And number one, and this is my on repeat thing is, when you're losing hair, you have to get a diagnosis. The question is why? Because what you do about it depends on why you're losing it. So if you have thyroid disease, then you want to address your thyroid disease.
Mhm.
If you have a nutritional deficiency, you want to address that. If you have an inflammatory scalp condition like CCCA, like we talked about, or lichen planopilaris, we call it LPP,
Mhm.
you want to address that. So that's how you want to approach it. Lots of things can help with hair loss, like a lot of the solutions can be used across multiple types of problems, but I do think it's important because the hair loss industry is exploding, and that can be a good thing and a bad thing. That can be that there's a lot of snake oil out there, or there's a lot of misdirection. People want to make money, and so they have a quote hair loss solution, but hair loss is a whole category. It's like saying
Mhm.
I have a cure for your infection. Well, is your infection a wart or is your infection COVID? Different
Mhm.
treatments.
Right. Right. I see people asking if there's like some supplements that you could recommend or natural ways to address thinning hair. And I don't know, as a dermatologist, if you normally do recommend that.
Well, again, number one, is that the reason your hair is thinning?
Gotcha.
So there are supplements out there, like, there are different brands of supplements. Um, there's Nutrafol is very popular, Viviscal, Fido, a lot of different ones, and they have different ingredients, and a lot of them are helpful at just supporting hair growth. You know what I mean?
Mhm.
But they're different supplements for different populations who have different reasons for losing their hair. The key is I see supplements more like changing the soil,
Mm.
just if you're just going in general for hair supplements
Mhm.
for a plant, but if your plant has a fungal infection, that might not be enough. The supplement might help the plant fight the fungal infection because it just boosts the plant. But also, I prescribe supplements sometimes, but that's after I've identified that somebody has a deficiency.
Mm.
It's
Okay.
important to know whether or not you have a deficiency, because just taking lots of biotin is not going to help your thinning hair if that's not why your hair is thinning.
Good. That's good. That's good to know. So I see Tamika Smith is asking, are there any specific labs that we should inquire about if the root cause of the hair loss is unknown?
Yeah, that's a good question. One, with hair loss, we have different categories. So whether or not we do labs will depend on what we're looking for. So I'd say the big ones to think about are scarring and non-scarring. Scarring means that something is happening and the hair follicles are being destroyed, and that's usually an inflammatory type of hair loss. And usually we don't get labs for that unless we're thinking lupus, right? And so if someone has shedding and we don't have an explanation for why they have shedding, that's the more common reason to order labs. And what I usually order, check their blood count, their ferritin to see what their iron levels are like. I check a syphilis test. I do an ANA to look for lupus. I check their thyroid. I just do a TSH, but what I also check is the thyroid autoantibodies, because that's what I find to be positive a lot of the time. Someone doesn't necessarily have thyroid disease that's affecting their thyroid function, but they do have high autoantibodies, which seem to correlate with their hair shedding. Vitamin D, I also check, and I check a plasma zinc. And then if someone, based on the history that they're telling, like if someone's vegan, vegetarian, or elderly, or just, I'm worried about, like, are you eating enough protein? I might check serum albumin, because if you don't have enough protein in your diet, you can shed your hair. But what's interesting about zinc that's important to know is that even with normal plasma zinc levels, if they're low normal, your zinc can still be the cause of your hair loss, because the test is testing for the zinc levels in your blood, making sure that you have enough to support your vital organs. When your levels are on the low side, sometimes your body is pulling the zinc out of your hair to support your vital organs. So your levels are normal. It keeps your levels normal by borrowing it from your hair. And zinc helps anchor hair into your head. So if you don't have enough zinc in your hair will start to fall out. So if you're on the low end of normal, I would still take zinc supplements for 3 weeks, with copper, because when you take zinc, your body loses copper. And then do that for 3 months and see if it normalizes and it helps you stop the shedding.
Oh, wow. I did not know this. Rolanda Mitchell wants to know, are there any suggestions for repairing postpartum hair loss?
There are lots of things you can do postpartum. I mean, it also depends on whether or not you're breastfeeding. One, you can do nothing and it will come back on its own. If you are not breastfeeding, you could try minoxidil over the counter. Minoxidil, that can help. There's also a cap that I recommend to a lot of people. I don't know that I'd recommend that someone make the investment, because, it costs a little money to buy this cap, and postpartum hair loss does resolve on its own, even if you do nothing. But if you happen to have female pattern hair loss or some other reason to invest in the cap, it's worth it, because you can use it throughout your pregnancy and you can use it postpartum, and it will help your hair grow back. There are also some supplements that people take. There are like formulation of supplements that are designed for that type of hair loss. But again, you can do nothing and the hair will come back.
So will it come back if it's coming out or shedding due to menopause? Will it come back then, or is it just,
Generally not on its own.
Okay.
I mean, a kind of normal life cycle type of hair loss, what we call female pattern hair loss, which is the genetic type of hair loss, usually happens before somebody's 40. And then if they start to get what looks like that at around the age 49, 50, that's the perimenopausal hair loss, which is from all the hormonal shifts. So it starts to look like female pattern hair loss, which usually on a women usually keep their hairline. Sometimes they get some bitemporal recession, like recession on the front, but usually women get thinning in the center in the front, and it makes a little triangle. We call it the Christmas tree sign. And so if you're getting that when you're 50, then it looks like that's what female pattern hair loss looks like, except it's perimenopausal when you get it at that age. The menopausal, there's another type of hair loss some women get just normally as part of our life cycle at around 60, where you just have diffuse thinning all around. It's kind of like your body's like, I don't need to make all this hair anymore. I'm tired. And, you can do things. You can use all the things like minoxidil, the red light cap, supplements, things like that, to just support your hair doing something that it doesn't want to do anymore. And then you can do things like PRP, or we have, instead of PRP in my office, the Almated device, which is a no needles, no blood, no pain. PRP is when you
Mm-hmm.
draw the blood and you spin out the growth factors and you inject that. And they use it for many things. They use it for joints, they use it for beauty, like skin. And it's also, the growth factors can be helpful for hair growth. But, there's blood, needles, pain, and it's a little less consistent because we don't know the quality of someone's growth factors in their blood. And of course, as we age, growth factors, are not as needed by the body. So we don't have the greatest growth factors. So Almated is more consistent. And so it uses ultrasound and plant-based growth factors that we vibrate into the skin that give you a nice burst of hair. So those are things that you can do to restore your growth.
Okay. So what about when the hair starts to break off in the back? Like, I know you mentioned the Christmas tree up here, but what about when it's in the back and it's, because my breakage always happens in the back first.
Yeah. Yeah. So breakage by definition is like your hair's coming out, but it's breaking. And that's usually trauma from the hairstyling.
Yeah.
I see that a lot in people who have eczema on the back of their neck or the back of their scalp.
Yeah.
Usually when I see that, people scratched their hair out. So that's one of the things too. Like if you have an itchy, inflamed scalp, that can affect your hair growth and it can affect hair breakage. So again, you want to, like, why is it breaking in the scalp? Are you pulling your hair too tight? Are you scratching? That sort of thing.
Okay. I see Berta McCallum has a question. She wants to know, since we're talking about it, can the dryness of a diabetic scalp cause hair loss?
Well, again, I don't know that, like, if the dryness is diabetes or it's that the person has seborrheic dermatitis. Diabetics are at increased risk of developing CCCA, the type of hair loss that tends to happen in the crown and spread out. That's scarring and can be permanent. That's associated with trauma as well, trauma in a susceptible person. So diabetics, they're in a more inflammatory state in their whole body, and they're more likely to get that. So that's one of the things they're at risk for.
Okay. And I feel like we kind of went over this, but just for those that are just coming into the room, and hey, y'all, drop where you're from, and if you like the new background and any questions. So how can a person determine if that hair loss is temporary or permanent?
Well, you would determine temporary or permanence by getting a diagnosis. So if you know why you're losing your hair, it's like a broken record, but it's so important. Like, why is your hair falling out? If you get scarring, meaning that the hair follicles get destroyed, that hair loss is permanent. Now, people who have those types of permanent hair loss, that doesn't mean that you can't get some regrowth of your hair with treatment, even if you have what seems like a shiny bald spot. I've been shocked over the years how, especially with the increased technology that we have available and methodologies, that you can get some hair regrowth. Sometimes the hair follicles are dead, and sometimes the hair follicles are just damaged. And so they have a hard time growing hair back without help. But with help, those hair follicles can grow back, and you can get like a cosmetically satisfactory improvement, even if it's not all of the hair.
Okay. Now let's talk a little bit about misdiagnosis. Why is it so common when it comes to hair loss in Black women, and what can patients do to advocate for an accurate diagnosis when they go to the dermatologist?
Well, I'd say particularly with Black women, I think it's just lack of education of the providers about Black women's hair loss, but hair loss in general. So hair, skin, hair, and nails are dermatology. And, where I trained, we had very in-depth, excellent hair loss training. And I thought that everybody got that. I just thought that was regular bread and butter dermatology. And when I went out into practice, I learned from the patients that, and also for some of my colleagues, not every program had that in-depth hair loss training. And I think also, when I started training, there weren't as many things to do for it. People might not have seen it as important. And so I think that's changing now. especially as there are more things to do for it. So if somebody doesn't understand, even a dermatologist, that, oh, hair loss, just use some minoxidil and keep it moving, or, oh, someone has CCCA, it's scarring, it's nothing you can do and keep it moving, they didn't really work it up. You know what I mean? There's no pat answer. You have to treat it like anything else. You have to take a history, and you actually have to know that there are different types of hair loss. You have to do a physical examination, and sometimes that's all you need to do, and you can make a diagnosis. But if you don't know what it is, you can do a biopsy of the scalp, and that can be very helpful. Sometimes you have to do the blood tests that we talked about, but you actually have to have an understanding of all the different types of hair loss. You don't just throw tests around. So what I see a lot of is that, say, patients go in and they see their primary care, they say they have hair loss, and maybe they just run some blood tests and they say, well, your blood's normal, so it must not be that. But they didn't order the right blood tests. They're not aware that maybe the type of hair loss this person has is not diagnosed by ordering blood tests.
Ah, okay.
CCCA is not diagnosed with the blood test.
Okay.
And
well, I was going to ask if because I've had this happen, just walking in and they're like, oh, it's stress.
Yeah, and stress, to me, I consider that a waste basket. Very, very, very. I mean, we'll learn more and more about stress, but like everybody would be bald,
Yeah, right.
If it were just stress. The types of stress that I generally accept as an answer for hair loss, and it's hair shedding, not all types of hair loss, not pattern hair loss, diffuse shedding of hair, is life-threatening stress. Like you were in a plane crash. You know what I mean? I've had one patient in my 25 years of practice that I looked at everything. She was definitely shedding her hair. And also, I remember medications can also cause hair loss. She was shedding her hair, and I couldn't find anything. And then when I asked her some of the history, she had been in an airport in India when there was a terrorist attack, and bullets had flown by her head. And it's usually 3 to 4 months before. That's telogen effluvium. So that's kind of the stress, like when you give birth, you have surgery, you have a C-section, you have COVID, and then it's not something that happens immediately. It's usually months later. And what's happening is that all your hair falls out of your head at some point, but they fall out in a cycle. And your hairs all have different cycles. That's why we're able to have hair, even though they all eventually fall out. What happens is that shock messes up the pattern. And so they all end up getting back into the same cycle, and they fall out at the same time.
Oh, wow.
Instead of at different times. So that's why it's so dramatic. And that's why the timing matters. And her timing was like 3 to 4 months from when the hair loss had started. And it was a terrorist attack with bullets flying through the head. I was like, by the head, I was like, yeah, I'll accept that as stress.
Yeah, that is stress. Yeah, for sure.
Yeah, no, but not usually like, I don't like my job, I'm mad at my partner, not usually that.
Okay. And we've kind of talked a little bit about the different, but if you want to go into more detail about the treatment options for the various conditions of like alopecia, I'm not even going to try to say the CCCA one.
Yeah. So if you have a type of hair loss that involves inflammation, and that could be what we call alopecia, which is alopecia areata. It's that autoimmune. It's the one that Jada Pinkett Smith reportedly has, where you get the smooth spots. Steroids can be helpful for that. They have now JAK inhibitor drugs that you can take that, because it can be chronic, and some people have it so severely that also affect that immune response that is attacking your hair. If it is lupus, you want to address your lupus, and steroids can be helpful for that, or other types of medications for lupus. If it is CCCA, steroids are also helpful, but there are also other things. such as, people use metformin topically and orally because it can affect the scarring that interferes with the hair loss. So part of that is like with inflammation, you have fire. So your scalp's on fire, you got to put out the fire. But putting out the fire alone may not cause your hair to grow back unless it's kind of early in the process. If there's been some damage to the hair follicles, you might have to do something that supports the hair growing back. So you put out the fire, keep the fire out, and let the hair grow back. So, we use the other things that we, use kind of universally for hair loss, like minoxidil, oral and topical, the red light. You can use, the metformin is more, it prevents the scarring that softens the area around the hair follicle so that the hair follicle can function. It's not necessarily anti-inflammatory, but it's the effects of the inflammation. We use laser light therapy for the alopecia areata, the spots that can be helpful for that. And then things like, PRP or Almated, which are putting the growth factors in. And then the supplements. So you think about it, it's like, if I have inflammation, you got to get rid of the inflammation and then help the hair grow back. And then just treating your disease. Like if you have thyroid disease, treat it, and that should help.
Okay. And then with menopause, you just got to ride it out.
With menopause, you can use minoxidil. You can use the light therapy. You can do PRP, Almated, things like that.
Oh, okay. Let's see. Guys, don't forget, drop your questions in the chat. The question just escaped my brain. You were saying something and I was like, oh, I got to ask about that. Yes, I remember now. So with alopecia, as you're going through whatever treatments it is it still okay to wear wigs and I don't know what those are called, where I guess the lace fronts, but there's another type of hairstyle where you can, if you're absolutely missing all of your hair, to still put that, I don't know what it's called. I can't think of the name of it. But anyway, are weaves and things like that okay to wear if you're in the process of one of these treatment options?
Absolutely. You just want to make sure it's not tight and contributing to your problem. But yeah, I mean, that's fine.
Okay. All right. Why is it so important? Well, you talked about why it's important for dermatologists to have experience with hair loss in Black patients, but how can patients find the right specialist? Because I think that tends to be a problem. I do know of someone that's in a small town where they don't have that experience there. So it's like, now what do I do?
So, that is a real problem, and there isn't like like an easy solution in terms of just do this. I mean, if you want to try to find a dermatologist, ideally you find a dermatologist who is competent with hair. Not everybody is. And then you want to find someone who's competent with Black hair. There are different, directories that list Black doctors and Black doctors who have experience with hair loss. You can ask them. You can check with the Skin of Color Society. They have a directory, but not everyone does hair. There's blackdoctors.org, find a Black doctor, Docs for Hair. So those are some different places that you can look. But I would just say a thing of caution, because hair loss as an industry is blowing up. Everyone wants to be a hair loss expert, and a lot of people don't really kind of think about all the different diagnoses and the medical way. They want to offer you a hair loss solution that's expensive and cash pay immediately. The first thing they want to offer you is PRP or, something that is not addressing your problem. So one, you want to get a diagnosis. And so let's say you have just a dermatologist who maybe is not as much of an expert in hair. They could do a scalp biopsy. That can be helpful. It's just that they have to know how to interpret it, and they have to know where on the scalp to biopsy. I would be careful going to people who are not board certified dermatologists, and they're dermatology. Everyone wants to be a dermatologist now. So again, because of that, we have a lot of people who are not trained. They're not board certified. They didn't do a residency. They're not even doctors. A lot of practices you'll go to, they will offer you a physician assistant, a nurse practitioner. And I'm not saying that someone who has that degree is not capable of taking care of you, but they're not necessarily trained, and there aren't regulations in place to make sure that they know certain things. And so what I found a lot is that people will go to a dermatologist and they end up not seeing a dermatologist and they're not aware of that. You know, I've had patients come in who have permanent scarring and they were going for help, but they kept going to someone who wasn't a doctor and who didn't know what to do and it wasn't supervised properly. And, you know, they didn't want to refer out, you know, when they got in over their head, and they just kept having the person come back, and they developed permanent hair loss and scarring, even though they were thinking they were getting some help. So I think you need to be mindful of whether or not somebody is helping you. Did they give you a diagnosis? Did they just say alopecia? Did they just say hair loss? What kind of hair loss? And then you know, you can go look that up. And then again, if your hair's growing back, great. But if it's not, or if they tell you there's nothing else to do, but they don't seem that expert in it, then that's when you might make an effort. Maybe you have to travel. A lot of people do telemedicine. Like I'm licensed in New York and Connecticut, so I can, you know, it's best to see hair loss in person, but at least I can weigh in on someone who has a license who's physically located in that state at the time that I see them. So you know, you want to get creative, but I wouldn't settle for substandard expertise with that. And I wouldn't spend a lot of money with somebody who doesn't give me a diagnosis, because I see a lot of people who've come in who've already done the very expensive treatments, and I can fix them with a $50 treatment.
Ah, gotcha. Let's see. Bonita Hampton wants to know, are you familiar with Episerum, I guess is how you say that, cream, and doxycycline for inflammation?
Okay, so of the scalp, so one of the other treatments that's used, particularly for CCCA, is doxycycline, which is an antibiotic. And it's not because you have an infection that it's used. Doxycycline is very anti-inflammatory, so that can help with hair loss. I don't tend to use it as much for this reason. It's an antibiotic, so you can develop antibiotic resistance, which is a big problem. Dermatologists are 2% of doctors, and we write 20% of antibiotics. And so you can develop a resistance that can be passed to different bacteria. And so when you do have an infection, you have a hard time finding something that can cure your infection, and it can have side effects. But there are low doses of doxycycline, sub-antimicrobial ones that are not antibiotics. It's just anti-inflammatory that you can take. But because some of the topicals in my hands work really well, I try to stay away from that, especially as this is a chronic problem. But yes, that is another way people treat CCCA. And Episerum is a barrier repair cream usually for eczema, but you can use for other types of skin inflammation. Wouldn't necessarily be my first choice for alopecia, because I would imagine it would be a little hard to rub on a hair-bearing area, and I would think that a steroid would be more effective. You just have to know how to manage a steroid on somebody on their scalp.
Okay. I see my hairdresser in the chat. Hi, Oni. She's definitely one that has worked with, you know, in hand to hand with my dermatologist, and she's good for taking a picture of my scalp and like, here, send this to her. So shout out to Oni.
Hairstylists are very important. They often are the ones who first identify that there's a problem. And, you know, people see their hairstylists more than they see their dermatologist or their other doctors. So, you know, they are very good at, you know, seeing when someone's getting worse, when someone's getting better. And then also, if you have a hairstylist that understands how they can help with someone's hair loss, they can make sure that their styling practices are not contributing to the alopecia. They can help people come up with solutions to camouflage their alopecia. And, you know, some hairstylists have more training in sort of like scalp health. These are called trichologists in the United States. There isn't as kind of an official licensing for trichologists, so you do have to be careful. People can just call themselves trichologists, and there's not a certain amount of training or a license they have, but there are training programs. So you could be legitimately trained as a trichologist. You just have to be, you know, buyer beware. You have to know
Right.
where you're going to. And they're not supposed to diagnose you. They're not
Mhm.
supposed to be treating your medical problems. If someone's, talking about your labs and they're the trichologists, that's not what they're supposed to do. That's a doctor's job. But what they can do is identify that you have a problem, and then they can help you. Sometimes it's like their scalp care, shampooing practices, things like that can help you manage your hair so that you have a healthy scalp and healthy hair.
Okay. Lynette McCallum wants to know, can weight loss medication cause hair loss or thinning?
Weight loss itself and weight loss medication can. So if you have rapid weight loss, that can be a cause of telogen effluvium. So people who would get, gastric bypass, that was a common side effect. And just like, with the Ozempics and
Mhm.
those medications, if you have rapid weight loss, you can even if you're just dieting, you can get telogen effluvium.
Mhm. Let's see. And I know you had some, I want to make sure we get this in. You had some resources you wanted to share. So can you talk a little bit about that?
Yeah. So, there are many different issues. There are many different types of hair loss. Hair loss is a medical problem, mental health problem, social problem. And so, because of that, and since I do so much hair loss, I did a blog that kind of outlined a number of resources. There are not for profits, communities that are supportive for people with hair loss, even legal advocacy things. So, for Black women, particularly, we have the Crown Act. I mean,
Mhm.
our hair is considered incorrect in some communities, it's considered unprofessional, our hair texture. And, that is the cause of a lot of job loss, health problems, mental health problems, low self-esteem. And I mean,
Mhm.
it literally causes medical problems. Um, so the Crown Act is, lobbying for laws that make it illegal to outlaw hairstyles that are appropriate for people with kinky, curly hair naturally. Our hair texture is, is not unprofessional.
Right. Right. Yeah. And I worked in news, TV news for a long time. And I remember, it's a different time now where you do see some women with braids, but back then it was like, absolutely not. You could not do it. Let's see. Guys, we got a couple more minutes. So if you have questions, drop it in the chat. And again, let me know what you think of this background. Um, oh, did you want to, let's see. Let's put up the blog so that everybody will know where to find it. Because it's on your website. We'll get to that in just a
And I
second.
invite people to send me if they know of any other resources that I haven't put up there. I'm,
Mhm.
happy to add them. If
Okay.
they have something.
Okay. All right. Perfect. Yeah. Oni says, yes, all Black girls have good hair.
That's right.
Absolutely. I need a t-shirt that says that. So do you have any advice for women? Like, are there any products that, when they're going into the store that they or the ingredients or routines that you recommend to maintain a healthy scalp and prevent hair loss that you want to kind of, you know, give them as that nugget before as we wrap this up? Though this conversation's been so good, you're gonna have to come back.
Yeah. So I'd say like generic advice, particularly for Black women, curly, kinky hair.
Mhm.
You have to understand this about your hair. So I don't know if you guys are familiar with Dr. Tina Lasisi. She's a hair anthropologist, and I heard this great lecture from her that explains a lot, and it translates right into what we should do every day. Um, uh, you know, we have a very unique hair texture, and it was designed to protect our brains from overheating when humans started to stand upright in sub-Saharan Africa. It's not designed to go past your shoulders. That's why it's more likely to break. It doesn't grow as long because that would overheat your body, but it grows out to insulate your brain. So, one, understanding that is normal. So, you know, wanting your hair to be different, we can want that for style, but that our hair is doing what it's supposed to do, right? That's what it was designed
Yeah.
to do. It is actually more likely to break. It is naturally drier. Um, we want to take care of it and have it break less and do what we want. So these are the things we have to do, given that our hair is like that. So one, everyone should shampoo their hair. I recommend once a week. Sometimes people have hairstyles where they do it less frequently. The reason we want to do it once a week is that it's good for your scalp. You know what I mean? We are more likely to get dandruff or seborrheic dermatitis, where we call it dry scalp, but it's actually oily scalp that's inflamed. And that's because the oil from our hair, because our hair defies gravity, that oil doesn't slide down your hair shaft. So people with straight hair complain about greasy hair, and we complain about dry hair and itchy scalp, because all that oil sits there and feeds the yeast, and we get itchy, dry scalp. So you do want to shampoo at least once a week, but you don't want to shampoo too much, because then that dries out your hair and your hair breaks.
Right.
But find a moisturizing shampoo. Try to use it once a week. And if you don't do that regularly, probably during seborrheic dermatitis season, like the fall or when it's very cold, if you're having problems with dry scalp, try to do it at least once a week, and you can use a dandruff shampoo. Get a moisturizing shampoo. Comb your hair wet. Curly hair, kinky hair is easier to comb wet. Straight hair is easier to comb dry. If you're combing your hair dry and you want a wide tooth comb, you're more likely to get hair breakage. So if you don't want hair breakage, comb it wet with some conditioner in it and use a wide tooth comb. Then you have to think of it like your skin. How you keep your skin from getting dry. Your skin has water in it, and the oil layer on the top keeps that water from evaporating. Same with your hair. After your hair is wet, you put something like a leave-in type of hair cream in there to seal the moisture in. And that's basically it. I like deep conditioning after you shampoo. If you can deep condition for a half hour, I just leave mine in all day until the next day. And that's the kind of basics. And then, of course, if you have some other kind of hair problem, then you have to get more specific with your hairstylist. But I'd say those are the basics.
Okay. Those are great ones. So how can people find you if they want to reach out, or if they're in the area that you can do telehealth, or they're in New York and they want to come and see you, or how can they follow you on social media?
So they can come to my office. It's a Glow Dermatology, AGLOW dermatology.com. It's in Manhattan near Grand Central, 150 East 37th Street. The telephone number is 212-627-1004. They can follow me on social media. On Instagram, I have my account is Dr. Dina MD, DRDINAMD. And then my practice is a Glow Derm NYC. They can follow me on LinkedIn at Dr. Dina MD. And those are the main places that I recommend that they follow me. I do a lot of hair content. We also have a Glow Dermatology YouTube channel. We do a lot of hair content because that's a big part of my practice.
Yeah. And your blog, can you tell them again where to find that?
The blog is my website. So it's actually Dina Strachan MD. A Glow Dermatology goes to that. So it's DinaStrachanMD.com. And then they can go to the blog. And if they put in hair or hair loss, dozens of articles. I get a lot of traffic just from people all over the country, all over the world, who aren't necessarily coming in, because we do a lot of educational content on my website on hair loss.
Oh, I love that. So I ask everyone this question, and I didn't send it over to you in advance because I just wanted, I wanted
Surprises.
to catch. Yes. What feeds your soul?
I love problem solving. I'm kind of like a little nerd like that. So I like being helpful. I like solving problems. That makes me feel good.
Oh, that's great. I thought you were going to say hair feeds your soul. That's where I thought we were going, but you surprised me. I want to thank you so much for joining us and sharing like all this great information about, our hair, because like we said, sometimes there's the misdiagnosis, and there's sometimes we just don't know how to advocate for ourselves. So this has been helpful, empowering. Thank you to the co-hosts in the chat for all the amazing questions. And I tried to post the link to your blog in the chat, so hopefully they can see that. Thank you, Dr. Dina. This has been amazing. You've
It's
got to come
been
back for sure.
of course, it's been my pleasure, Shamika. Thank you so much for having me.
Oh, there it is. It's at the bottom of the screen, you guys, if you need her, the blog. So make sure you, and if you missed that, you can always come back and watch it and grab it again. And I think I put it in the chat. I may not have done it so well. Um, and then let's see. And one more comment from Oni. She says, so many great products, but make sure everybody follows the manufacturer's directions and get with a licensed professional who can help you with what your hair needs. Thank
Well
you for that.
said. That's
Yes.
right.
Yes.
Licenses matter.
Exactly. Exactly. So again, thank you, Dr. Dina. Thank you, co-hosts in the chat. For more information about hair health, including hair loss and treatments, you can check out Dr. Dina's blog, and you can head over to blackdoctor.org for more articles and resources there. And next week, we're going to be taking a look at self-care because we need it with all the things on the news and all the things going on in the world. So we're going to talk about
Yes.
ways to implement it, because especially as Valentine's Day is coming, you may be single, you may be part of a couple, but you still need self-care. So we're going to talk about that. So I want everybody to have a soul-filled rest of the week, and I will see you guys next week. Bye.